everyone and welcome to Rad Chat. My name's Jo McNamara and I'm joined by my fellow host number John Anderson.
Hi everyone.
So here we are at UKIO and we're joined by two beautiful ladies. Would you like to introduce yourselves please?
Yeah, hi, I'm Steph Jones. I'm the Senior Project Manager at the Cheshire Merseyside Cancer Alliance.
And I'm Nicky Hutton, Primary Care Cancer Engagement Manager at the Cancer Alliance.
So they sound really fancy titles.
They do.
Give us a little bit of background. What is it that you actually do?
So I work between the primary care team and the screening team, so I do a lot of work with local GP practices, PCNs, and really trying to engage people in the work of the primary care team, so screening and sort of quality of cancer referrals. And that sort of leads into the other half of my work is with Steph's team and the screening team.
And you are a therapeutic radiographer by background,
yes.
And every time we've been at UKIO, you've been in the pod box as well.
Somewhat different.
I love it.
Yeah, and I work in the primary care team with Nicky and also in the screening team. So again, just working with stakeholders across Cheshire and Merseyside to increase uptake for screening initiatives across like the 3 cancer screening programmes. And then I also work in the primary care team for the dashboard project, which I work with Nicky on.
So if anyone doesn't know what screening is, what is it? What is it that you're essentially trying to do for people?
Just to kind of get them to go to appointments and then obviously see if there's any cancer there. I mean, 9 times out of 10 there isn't, so which is a good thing, but I think that there's a lot of stigma and barriers around going for cancer screening, and that's one of the things that we're trying to do now, is trying to reduce those barriers and let people go for screening.
And also the education, I think, as well, so that people know that if they do have a cancer diagnosis, it's easier to treat and the outcomes are better if it's picked up earlier. So we're trying to educate and break into lots of different communities, so not just sort of go out to people who we know are listening, but the communities that are maybe a bit harder to reach. So that's quite a lot of our work at the moment, isn't it?
Yeah.
How do you kind of convince people that although 9 times out of 10 there's not going to be a problem, that 1 out of 10 is why you should definitely do the screening? I think we often speak to patients who say, yeah, I didn't go for screening because I didn't think I needed it, but then obviously they did need it.
Yeah, I think that's one of the things that we're trying to do at the moment with our social media project. We've just created a Cheshire Merseyside screening for social media platforms across TikTok, Instagram and Facebook. But we're trying to kind of educate people and say, it's not about having symptoms. You might not have any symptoms, there are going to be underlying things there, but these are the reasons why these age cohort of people should go for those appointments. That's one of the things that we're trying to get across, isn't it?
I think using patient stories, I know you guys do that a lot, trying to get people who've had, there was somebody the other day, wasn't there, who said, it was raining on the day that I was going to go and something else came up and then actually I did go and I got diagnosed with early stage breast cancer. So she's done quite a lot of comms for the Alliance. It's just getting those stories that people can relate to because they don't think they've got a problem and then they have. Yeah.
And what is screening uptake like? Is it pretty dire? Is it deserving of a whole project?
All the programmes vary, don't they?
Yeah.
That's one of the things that we've now got a practice dashboard which Nicky and I have been working on. So it kind of shows us across Cheshire and Merseyside what is going on in all the different areas, and we can really home in on filters, so we can look across people who've got severe mental health, learning disabilities, ethnicity groups. So it's really good because we can actually look into these smaller groups now and figure out who's going for the screening and who isn't.
Yeah. But
I think Nicky probably knows more about the actual statistics.
So it's broken down. You can look at it and you can look at it across the whole of Cheshire and Merseyside. You can look at it across all the 9 places. Then you can break it down to a PCN or a specific GP practice.
Right. So
you could then filter by your practice and all the filters that Steph said, and you can then look and say, so people with a severe mental illness generally 20% lower screening coverage than those without. So then that you can go into that GP practice and say, we need to do some work with this group of patients. You can add an age group, an ethnicity, a gender, and have that really small subset of your population. So it varies massively across Cheshire and Merseyside. I guess it does anywhere really. But that means we've been able to work on some projects. So we've used, because the dashboard's new, we've got these early adopter projects. So we've pinpointed areas where we can go in and offer some support. And we've now got things like extended access for cervical screening. So we don't even the weekend clinics in an area where coverage was low, but the GP practices were saying actually people are coming to us and saying, do you want to come? It's just that we're working, can't get time off work. So that's kind of going now. We've also got another project in Liverpool in one of the most deprived areas where we are funding bus passes to get to the local screening unit and tying that in with education. So it's just being able to, it's like having the insight really, isn't it? And then obviously that's where our job comes in and we can then go in and sort of help provide that education.
How can healthcare professionals help you you? You know, if they're maybe utilising the dashboard.
I think most of it is about awareness of using the dashboard, really, and that's one of the things. It's only been live since October, November, so we're trying to really get it out there. We've got quite a lot of users now, but I think just kind of talking to the patients, sort of the every contact count, just even if patients are in for a different reason, talking to them about screening. And it's really hard with GPs because there's so much that they have to do as well. So that's kind of our role, is to provide them with stuff that they can kind of support their patients with. I guess for healthcare professionals as well, we're looking for people to follow us on all our social medias now, people to create content. So that's kind of what everyone's doing at the moment, is filming patients, staff, people from different professions, people who've got relatives who've had a good or a bad experience. We're just trying to get a whole picture really of what.
And if they're doing any kind of projects themselves, I think sometimes people just go off and they're doing all these different projects and they don't know the worth in that and about communicating it out to kind of like us. So those we need to know about all those projects as well, just so that we can help influence those areas.
You're linked in quite heavily with NHS England now, aren't you? So it's kind of all tied in. So they know what we're doing, we know what they're doing.
Let's fast forward 1 year to UKIO 2026 when you both come back.
We'll be here again.
What do you hope to achieve by then?
We hope that the dashboard's successful, and that actually at the moment we're kind of facilitating the dashboard projects and what have you, but we want people to use the dashboard on their own and then come to us and say, we've already done this project, this is how well it's worked. So that will be probably I think for a year's time the goal of ours. And then for the social media as well, just to increase the followers and get some interaction there, because at the moment we've only just started that. It's only been live about a month or so. So we just want to make sure that that's as successful as it can be and that we've got the content to create really.
Brilliant. What's your handle?
Well, there's a few different ones, but we've got Screening Cheshire Merseyside. There we are. So it's either various things, but it's mainly Screening Cheshire Merseyside or Cheshire Merseyside Screening across all Instagram, Facebook, TikTok and LinkedIn.
Perfect. Brilliant. Well, good luck with everything.
Thank you.
Thank you so much for coming on Grad Chat.
Thank you very much.